Hey everybody, welcome back to anatomy class. Today's lecture we are going to be talking about wound healing. Okay, so wound healing in general refers to the process by which the skin or any other injured organ repairs itself after some type of injury. Okay, so this section specifically, we are going to be talking about skin wounds. Okay, they can be classified as either epidermal, okay, or full thickness. So epidermal means it's shallow on the surface. Okay, we have to remember that the outermost layer of the skin is your epidermis. Okay, and then for full thickness, it means the wound is deep and it has damage to the dermis. So again, we have to make sure that we remember the different layers of the skin. It's the epidermis, and then underneath that is the dermis, and then it's the subcutaneous fat layer. So there can be many different causes of wounds. So the first one is trauma. So what that means is maybe you bumped into something and it cut you, or um, something sharp cut you either by a person or by accident. Okay, scalds and burns, animal insect bites and stings, pressure sores, metabolic diseases like diabetes. Okay, these are different causes of wounds. So for skin wound healing, there are four specific stages. We have hemostasis, inflammation, proliferation, and remodeling, which can also be called maturation. So if we take a look at this figure, this shows you the four steps of wound healing. So hemostasis, inflammatory, proliferation, and remodeling. Okay. So the first step of skin wound healing is called hemostasis. So this happens immediately, okay, after your injury. So what happens is something called vasoconstriction. Okay, so you have to think of the word constrict, which means to tighten. So what first happens is your blood vessels constrict, okay, around the wound site. So hopefully to keep it from bleeding out. Okay, and the platelets, which are in your blood, come in contact with collagen. Okay, remember we have to remember that collagen is like a protein network that creates the structure for connective tissue. Okay, so once the platelets from your blood comes in contact with collagen, it results in the activation of fibrin. Okay, and what starts to happen is something called aggregation, which is a formation of a mass. So in other words, a formation of a scab. Okay, so again, what happens once you get an injury? Okay, your blood vessels usually are broken, so you start bleeding, and then the platelets inside of your blood come in contact with your open wound, the collagen in your open wound, and it activates fibrin. So after that happens, okay, the opposite of vasoconstriction occurs, which is called vasodilation. So then around the wound, after the scab starts to form, blood vessels expand, okay, and then what's the purpose of that? To get more platelets and fibrin to the site. Okay. After that, an enzyme called thrombin, okay, that's an enzyme, and it initiates the formation of a fibrin mesh, okay, and then the platelets from your bloodstream clump into a stable clot, which is essentially called a scab, okay. And lastly, in hemostasis, growth factors, okay, from broken and damaged cells are released and initiate the next step, which is called the inflammatory response. Now, right before we go to the next slide, if we take a look at this figure on the bottom right here, okay, so first we see the initial injury, okay, we see maybe there's a puncture in your skin, and then it cuts through your blood vessels, so which causes bleeding. So then that releases platelets into the wound, and it comes into contact with collagen fibers. Okay, so there are stringy fibers all along your connective tissue. Okay, that kind of gives structure um, to your connective tissue. So after that happens, after the platelets come in contact with collagen, it activates the fibrin. Okay, and it starts to patch up the wound. Now we have stage two, which is called inflammation. So the key word that you have to make sure that you know is called erythema. Now, erythema, okay, is swelling, warm, and pain that are associated with the inflammatory response. Okay, so what happens is um, once your wound opens, okay, your immune system is also activated. So specific cells called neutrophils and macrophages are attracted to the wound site because once cells are broken, they release growth factors, okay, that attract your immune cells to the site. So it's like an automatic response. So then what happens is the neutrophils and the macrophages, okay, they undergo phagocytosis, which essentially means that they go and they remove the debris and they kill the bacteria that have entered the site. Okay. So now when the neutrophils and macrophages die, okay, after they do their job, okay, they start breaking down, and then it attracts the next step. It's called fibroblasts, mast cells, and epithelial cells, which takes us to step three. Step three is called proliferation. Okay, proliferation happens in three steps, three stages. Okay, first, the wound is filled, contraction of the wound margins. What that means is the outside edges of your wound start coming together and then covering the wound, which is called epithelialization. Okay, so what that means is your wound gets covered back up with epithelial cells, so your skin cells. So first, what happens is filling the wound. Okay, shiny granulation tissue. It's just a type of tissue. It fills the wound bed with connective tissue, and new blood vessels are formed. Okay. Second, it's called contraction. So the wound margins, which means the outer edges of the wound, contract, okay, and they pull toward the center of the wound. So it tries to connect the ripped, essentially the punctured parts of your skin together. Okay. What happens at that same time is as your the edges of your wound get closer together, fibroblasts they secrete a, a matrix of collagen. Again, we have to remember collagen is for structure. Okay, it secretes a temporary matrix of collagen to reform the epidermal tissue. So then it finally closes the wound. The last step, epithelialization. Okay, new epithelial cells come from the bottom of the wound, okay, and begin to migrate across the wound. So it essentially creates a bridge between the punctured parts of your skin. Okay, and then the last part, keratinocytes. Okay, that's what are responsible for epithelialization. So we have to remember that keratinocytes are special type of cells. Okay, that help to form epithelial cells. And lastly, stage four is called maturation. So this last stage, so the in stage three, the wound is closed and new epithelial cells cover the wound. In stage four, the new tissue slowly begins to return back to normal. So it gains strength and flexibility. So the collagen fibers, okay, they reorganize and the tissue remodels and matures, okay, and then it eventually becomes um, about 80% of the maximum strength of the pre-injury. Okay, now if you look at this timeline a little bit, again we see the four phases of wound healing. So phase one, hemostasis, takes between 1 to 3 days. Okay, hopefully the bleeding stops well before then. Phase two, which is inflammation, usually from days 3 to 20. Phase three, okay, where the wound is closed and new skin forms over it. That happens between week 1 to 6. And the last part, okay, where it's called remodeling or maturation, where your skin tries to return back to normal, that can take up to 6 weeks to 2 years. So depends on a lot of factors, like your age and demographic. Okay, and then this last side talks about two things: factors affecting wound healing, okay, which is here on the right. So factors that affect wound healing are moisture, infection from things like bacteria, your age, your nutritional status, and the metabolic conditions. Okay, so nutritional status, that means you eat a full meal with the needed amount of nutrients so that your body can repair itself if it needs those nutrients. And then on the left here, we look at this figure. We see the stages of wound healing, and then it gives you a brief summary of what happens in each stage. So, stage one, hemostasis, formation of platelet plug, okay, and formation of a clot, which is like a scab. Inflammatory stage, that your skin becomes, the wound becomes inflamed because your immune system is responding and it begins the removal of bacteria and cellular debris. The third stage is the proliferation stage. Okay, that's where your skin, your wound begins to close, and new skin cells are placed over the wound, which is called re-epithelialization. And the last stage, the remodeling or maturation stage. Okay, um, your skin becomes stronger and gets up to 80% of its strength back. And that's it for wound healing.